Welcome to Notebook, a program of interest to the St. Lucie County community that features information about St. Lucie County schools. Guests include school district and community leaders with focus on children in our community.
Hello, and welcome to another edition of Notebook, a show where we connect you, our viewers, with community officials, school district personnel, and organizations that impact children and families in St. Lucie County. I'm Dr. Greg Earn.
And I'm Jane Whitaker, and we're going to serve as your co-host today as our focus is going to be on health awareness and health promotion for students and families throughout St. Lucie County. And we're really excited to have our three guests with us today. And with us is Mia Hume, who is the Health Services Coordinator for Students with Disabilities as part of St. Lucie County, and Tricia Goulet, who is the school health nurse with the St. Lucie County Health Department, as well as Elizabeth Pantana, who is also a school health nurse with the St. Lucie County Health Department as well. Thanks for being here with us.
Thank you.
Thank you for having us.
Thank you for being here. Ladies, we'd like to ask you to just start with taking a moment to tell us about yourself, about your professional roles, and how long you've worked with or in partnership with St. Lucie County Schools. I'll start with Mia.
Okay. This is my 15th year with the school district. I started as a school nurse for a full-service school, one school, mainly with the children with disabilities in the medically fragile classroom, and then moved to the district office as the ESE district nurse, and then as that grew and the district grew, we ended up with a second coordinator. So there's Kim Pennington, who is the district health coordinator for all the gen ed students and the general population of the school. And then I do all the students with disabilities.
Okay, thank you. Okay, we'll ask the same question for Tricia.
Yes, I've been with the St. Lucie County Health Department for about 5 years, and I've worked as a school health nurse throughout. I have 7 schools in the county that I work with.
Wow, that's a lot.
Yes.
Okay, thank you. And Elizabeth, how about yourself?
I've been a nurse for 25 years, and I've been a school nurse for this is my 7th year in St. Lucie County as a school nurse. I have 4 schools, and I work for the health department, but part of my salary is paid for by Children's Services Council through a grant.
Okay.
Very
You're all
good.
very busy.
Very busy, nonstop. Well, I know as we continue through this show today, we're going to just give you some questions just to kind of inform the community and, again, with our students as well, just on some of the basic resources that we have that maybe a lot of the community members out there listening aren't aware of. But one of the things that we wanted to kind of focus on is really beyond the academic expectations for the kids. We have to make sure that our students are really well prepared, not just academically ready to learn, but that health and wellness has such a huge component to their success in the classroom. So one of the things we want to look at today is maybe provide some helpful information as to what the services are provided through St. Lucie County. And I know you guys are going to be able to share a lot of great information with us today, so we're excited.
So we are going to start with Tricia. We're going to ask you to please start and talk a little bit about Florida's school health program. For example, we want you to talk a little bit about the mission and why the Florida School Health Program was established.
Well, the school health program was established by the Florida statutes to provide various services for schools throughout the county, throughout the state. The mission of the school health program is to praise, protect, and promote healthy children and healthy schools. Preventative and emergency school-based health services were provided for children in kindergarten to 12th grade. Our school-based services help to assure that students are healthy in the classroom and that we have a healthy school environment for our children. We have a school health program as a collaboration with the Department of Health and the Department of Education, so we work together on our school-based services in our healthy environment for the children.
Okay. And you mentioned the Florida Health Department, and what are some of the things specifically that they provide?
Well, the school health is provided by the health department. Our school nurses, we have 8 RNs that are employed by the health department, 39 schools in the county, and we have approximately 40,000 children that we see. And some of the service that we provide are nursing assessments, health counseling, screenings, referral follow-ups for health conditions. We do health education in the schools. Some of our nurses go out and do hand washing classes, water safety classes, hygiene classes. And right now we're working with Children's Services Council and Children's Home Society to promote a 5210 in the schools, which is 5 fruits and vegetables, 2 hours or less of recreational screen time, an hour of physical activity, and 0 sugary drinks. So that's what we're working on now to promote. Some of our nurses, we also work on developing healthcare plans for health conditions, and first aid and emergency services in the clinics, and we communicable disease prevention. And we also work on policy and procedure out there in the schools as well. And each school is employed by a health paraprofessional, which is an unlicensed assistive personnel. They oversee the clinic. 8 of our RNs go in and delegate services, whether it's medications or emergency services for the children. And so the nurse at the school is a liaison between the community, between the families, school personnel, physicians, because some children our nurse may be the only health care provider that they have access to. So yeah, so that's what we do. That's part of our school health program from the Department of Health side.
We really do a lot in the schools in collaboration. Thank you.
Yes.
This question is going to be directed both Mia and Tricia, or Elizabeth, you can chime in as well. Tell us a little bit about the various health screenings that are done in our schools, and particularly what is mandated by the state and when, what grades.
Well, we screen, 8 of us nurses screen first grade, kindergarten, 3rd, and 6th. There are state mandated screenings that we do. We go in with the kindergartners and screen vision and hearing. First grade is vision, hearing, and growth and development. 3rd grade, we do a vision and growth and development. And we screen our 6th graders for those services with vision and hearing, growth and development, as well as scoliosis. And we go ahead and do referrals for children that have failed screenings. We're required to send 3 letters so that they can see a healthcare provider if they need glasses or a hearing aid or some treatment with scoliosis. Last year, we screened 12,000 visions. Did 12,000 vision screenings, 8,000 hearing, 3,000 scoliosis, and 9,000 growth and development. Yeah, so that's a lot.
A lot.
Wow.
Yes.
And Elizabeth, I know your focus is more the dental health type things. Are there screenings that are done at certain grade levels that you guys kind of focus a little bit more on?
Well, I am the Oral Health Coalition chairperson.
Okay.
And in the schools providing dental services is a dental hygienist. His name is Irvin Valson and Pat Johnson. And they go into the schools, 12 different schools, and screen students from preschool through 2nd grade. They screen the 6th graders at Dan McCarty, and they screen the students at Dale Cassens. They provide education for oral health education, and they provide toothbrushes, and even have students brushing their teeth after lunch in school. Then they do referrals and follow-ups and actually case management on the children that need to be seen by a dentist. Tooth decay is the most prevalent childhood disease in St. Lucie County and in Florida and actually in America. So they are very busy. They also do emergency screenings for any student in St. Lucie County if a child is in pain.
Wow. I remember even as a kid in elementary school way back when they would come and do the screenings and give us new toothbrushes, and then they gave us those little red
fluoride pills.
Yeah, and we always thought that was really great when our teeth turned really red and got to show how good we were at brushing. But those were, even back, 30 years ago, 40 years ago, even just remembering the impact that made and how important it was really for the dental health as well. Let's go another question with Tricia, if you don't mind. One of the things that we had talked about just prior, earlier in the show was you had mentioned that part of the funding for Elizabeth, I know you had mentioned, is covered by the Children's Health Council. How are health services actually funded? And that may be something that Mia can maybe touch on too. I don't know. But Tricia.
Well, funding for school health services in St. Lucie County comes from many sources. The school district provides a salary dollar amount for the health paraprofessionals, coordinator, and other health staff. The Department of Health nurses, the state and county provides funding for the Department of Health, but Children's Services Council funds 50% of 3 of our nurses' salaries. So the Children's Service Council nurses have a lower student to nurse ratio because they're in the schools providing more services, to the students. So, yes.
Just a great community collaboration
Yes,
altogether, which
it
is
is.
really amazing.
It really is.
Okay.
Yep.
Good.
Speaking of collaboration, I know that the School Health Advisory Council is a real collaboration, and it's also known as SHAC.
Yes.
We're going to stick with Tricia,
Okay.
but really anybody chime in here, because I know that multiple people are part of this committee. But if you can tell us a little bit about SHAC, what it is, maybe what the goals of SHAC are, as well as who serves on that committee.
The School Health Advisory Council is what we call our SHAC. Not a lot of people have heard about it, but that has been around for a while. The Department of Health actively participates and supports the School Health Advisory Council. The SHAC is comprised of school district staff, Department of Health, community members, and parents. We encourage community members and parents to attend. The goal for the SHAC, is to identify issues affecting the health of the students in the community. We welcome people to come. The SHAC meets the second Tuesday of every month at the school district in room 237 from 2:30 to 3:30. Karen Heisler is our chairperson, and so that's what it's been meeting for quite a while, and we encourage parents, we encourage different staff members throughout the school.
Okay. And Karen Heisler is the supervisor of district nurses?
She's
or-
our supervisor, yes.
Okay.
The school health program for the district, the Department of Health. Sorry, not
Thank
the
you.
district, but the Department of Health.
All right, thank you.
And Mia, this will be a question for you. Share with us just a little bit about the collaboration between St. Lucie County and the Health Department, and how that looks maybe from your perspective and how that works together.
Well, we work, excuse me, we work very closely together with all the school health nurses. I supervise the school board nurses. So we have our health department nurses that visit, have their schools that they visit, and then we have our school board nurses, which are based in our medically fragile units. And we have 6 units spread out throughout the district. There are 3 high schools. North is Fort Pierce Central. Then we have Centennial and Treasure Coast High have a unit each. Sam Gaines has one for K-8 north, and then south we have Westgate that actually has 2 units. And in those classrooms there's a teacher, usually 2 aides, classroom aides, and then an RN that's based in that room. And so those sites actually have an RN that's there for the entire day. She's based in that classroom and is mainly responsible for those medically fragile children in that room. But if we have other children with significant medical issues that attend those schools, then that nurse works in collaboration with the health department nurse for any of the children that may get their medical services at school through the clinic, through the health aide, or they may come directly to the RN that's based in that medically fragile classroom. And then we also have LPNs that we employ that are one-on-one nurses. So if we have a child that is so medically fragile that we need a nurse with them all the time, not just in the classroom, then we hire a one-on-one nurse, and that nurse goes out to the house in the morning, does a quick assessment of the child, makes sure that everything is available and ready for the child to come to school, and then rides the bus in with the child, spends the day providing the medical care, and then rides the bus home again in the afternoon. So every child has a right to an education, and if we can safely provide the health services that they need at school so that they can access their education, then that's what we do. And so at this moment we have 2 LPNs that are one-on-ones, and then we have the RNs that are based in those 6 classrooms. And then I have 2 float nurses, because of course when people call out sick, then we need somebody to
Yes,
cover.
right.
Because it's not, we have to have a nurse in those positions. So then we have the float nurses that help when people need a day off or
Right.
call out sick.
Right.
So we work with the health department nurses, pretty closely, because those are their schools, and then we also have an RN in that classroom. So the health department nurses that visit those 6 schools, they have a good relationship with the RN that's based in that classroom. So they work collaboratively together. We also work very closely with Children's Medical Services, which is usually known as CMS, and it's up here in Fort Pierce. And lots of our children with medical issues, severe medical issues, go to CMS and see the specialty doctors that come up here to do the clinics. So we don't have any pediatric specialists per se that are in this 4-county area. And so these doctors through CMS come from Miami, they come from Fort Lauderdale, West Palm, Gainesville, Orlando area, and provide the specialty clinics like pulmonary or cardiac or whatever is needed for those CMS clients. And mainly those clients are, it's Medicaid funded.
Right.
So we do work very closely with them, and some of our CMS nurses have come to the schools to see how their children are doing in the classroom. I've made home visits with CMS nurse to a family when we've had issues that we need to resolve. So it's a big collaborative effort, and actually CMS is also part of the health department.
And I think it's very important for our viewers to see how what a collaborative effort this is, as well as how highly qualified those of you who are working together in health services are. So I also wanted to talk a little bit about recognition received. I don't know if that's something that I know through the health department there have been several awards. You want to talk a little bit about distinctions or awards that?
Yeah, they were a recipient of 3 Davis Productivity Awards, and we've also been awarded along with the district, the Silver Award for Healthy Schools for the past few years. So as the health department and the school district work together on that as well.
And could you tell us exactly what that Productivity Award actually entails? Much about?
The Davis Productivity Award is actually awarded to programs that save the tax dollar money. The Hands Pediatric Dental Program was awarded the Davis Productivity Award, I believe, in 2011. And because of the money that we save by treating children early and doing preventative care, then it saves the taxpayers in the long run, because often the children with dental pain end up in an emergency room and have extensive dental problems.
Right. Well, that's good to know, because that's something that I wasn't aware of, even being in the district for as many years as I've been. So that's a pretty prestigious accomplishment. That's amazing. Great.
I think just to follow up with what Elizabeth was saying about dental health services, I want to ask you a little bit more about that. But at the same time, Jane had spoken a little bit about when you were a child. You remember some of the things that were done, and I remember myself some of the fluoride treatments school-wide. I don't know if that is something that is still recommended in dental health, but I remember being in school and having fluoride treatments. I don't know if that still occurs.
Yes. In St. Lucie County, we are fortunate that most of our families have fluoridated water, which is very important. Some dentists certainly do fluoride rinses or fluoride swabs, but we do not. One thing that a grant has just been obtained from the United Way of St. Lucie County for Irvin and the Hands Pediatric Dental Program to provide sealants. And the plan is that he will provide sealants for 500 children in the school district this year. So we're very excited about that.
That is great.
That's awesome.
I know you've also presented probably numerous times to the school board and other agencies about the good work that's happening with the dental health program. And you told me, so I'm going to give you an opportunity to talk a little bit more about dental services. If there's anything else you'd like to share about that.
Well, it's a fantastic collaboration in our community, and the St. Lucie County Oral Health Coalition acts as the advisory committee to the Hands Pediatric Dental Program, and so many partners are involved in it. Children's Services Council, the Early Learning Coalition, Head Start, of course Hands and the Health Department, and it's just a fantastic collaboration. United Way and Children's Services Council provide most of the funding, and the children receive dental services. Hands is able to pay for emergency care of children that can't afford to receive services.
So the St. Lucie County Coalition is just the culmination of all those groups together, working together collaboratively to really provide those services then?
Planning
Okay.
and making
Right.
plans and
Kind of seeing and implementing
Yes.
them. Yeah, great.
And I'm going to go a little bit further with that. We're talking about the oral health issues, and we don't really think about that much when we're always thinking about reading, writing, and mathematics and all the things that happen in schools. But oral health issues really can be looked at as one barrier to learning, as well as all the other health issues that we will discuss today. But can you touch a little bit more on that, why it's so important to pay attention to this area?
Absolutely. So many of our students come into the clinic with dental pain. And so many of our students don't complain about the dental pain. And when they receive their screening, when they're asked, do you have pain, they say yes. I think of one child that was a third grader that never was seen in the clinic. And when he was screened and asked if he had dental pain, he said yes. And when he pointed to about 4 or 5 sites in his mouth, he said, my head throbs every day. And this was a child that was having some behavioral issues. And so it can certainly affect a child's behavior. When they're in pain, there is a lack of sleep. They have focus issues. It's hard to concentrate when you're in pain. And so it can affect test scores and academic performance. It also affects speech, because if you're missing teeth, it's hard to pronounce words. It can cause death. It can lead to infection, and untreated dental abscesses have led to death in children in America.
Okay, thank you for sharing that. Mia, we're going to go back to you, and I want you to talk just a little bit more, if you could, about the fact that as a school district, we employ both a health services coordinator, who's Kim Pennington, within the Student Services Department, but also yourself, who's the health services coordinator for students with disabilities. So if you can just give the audience a little bit more information about what the difference is, maybe if there are similarities and overlap of some of the things that you do work on together, and what are distinct.
Again, we're very collaborative. We work very closely. Kim and I are right across the hall from each other, and when we're in the office, we're always talking back and forth about, issues that are going on. But Kim is generally over all of school health. I mean, she's the coordinator for everything that goes on in the district school health-wise. And that includes the health aides that work in our clinics. It includes working collaboratively with the health department. It includes the shack. It includes the whole picture. And then I do any student that comes into the district who has a significant medical issue or medical disability usually comes through me. And so I'll get a referral from a school, a child from another state will come in with an IEP from out of state and a health care plan from out of state, and then they'll be referred to the ESE office, and then I'll get called to come review the medical records, and we have to figure out where the best placement would be for that child. We consider a number of things. We would consider whether or not the child needs to be in that classroom, that medically fragile classroom, whether they just maybe need to be on the campus where there is a nurse there all the time in one of those 5 units, or can that child be served through the regular clinic at the school with the health aide and getting medications on a routine basis, or whatever is needed for the school day. So we do a pretty in-depth review of all the medical records, and we get releases signed by the parents to talk to the physicians. We have the parents fill out questionnaires on what it is that the child has, if they have a seizure disorder, do they have a cardiac condition, what does it entail, have they had surgeries, are they on medication, who the physicians are, and then we work up a healthcare plan, a specific healthcare plan for that child. And then if they're in the classroom with the medically fragile students and there's an RN based in that classroom, then I'll turn it over to that nurse. And that nurse will then do the training for the personnel in that classroom. OT-PT sometimes has to be trained because they're in and out of those rooms a lot. Speech is in and out of those rooms. And so if we have a child that has a seizure disorder, then once we write the healthcare plan, we have to do what we call child-specific training for any staff member that's going to come in contact with that child. So we would have to gather all the staff together that's going to come in contact with that one child at that school and sit them all down and go over the healthcare plan with them, exactly what it is specific to that child. Because in the instance of seizure disorders, everybody's different. Seizures are different in every child. The medication that they take is different. The time frames for emergency drugs administered are different. And so Florida law says that we have to do child-specific training, and it has to be done by an RN, an ARNP, or an MD. And that's in Florida statute. So right now in this district, we have an emergency drug called Diastat that we use to stop seizures. And there are 79 children in the district now with Diastat ordered. And so it takes a lot of coordination and a lot of training to get everybody trained and have the medication at school and have it done correctly and have it there and available when we need it. And the same thing with EpiPens. We have tons and tons of EpiPens.
And glucagon.
And the glucagon for the
Right, right.
diabetics. And so the collaboration between the health department nurses and myself and Kim, has to work. We have to make it work seamlessly so that we have all the medications available for every child that whatever they're going to need during the school day. And in addition to that, we also train our ESE bus drivers and bus aides. And so if there's a medical condition of a child and that they're going to be riding one of our school buses and they're going to need an aide or a monitor on that bus, which would mean they would ride, the special needs bus, then we have to train them so that they would know the signs and symptoms to look for, when to administer the emergency med if they needed to administer it, and the follow-up with what we would need to do after that. So it's a very interesting job. In 43 years of being a pediatric nurse, this is probably the most challenging job I've ever had. It's even more challenging than working in PDICUs, and it's
something different every day.
It's something different every single day.
Because some days we don't know what we're coming into when we walk into the schools.
You never know what is going to be on the other end of that phone call.
Yeah,
Right.
it's a different,
It's different every day.
And I even remember as a classroom teacher, even having you come in and train, what an in-depth plan. I mean, from the beginning of the school day to the end of the school day, every step and transition had to be planned out to make sure, to provide that safety and coverage for the students that were in need of those medications that you were talking about. And, just even that plan that, trying to map everything out to make sure every moment is covered, that takes a lot of time and effort.
Yeah, it takes a lot of planning, and I'm really proud of how we do that in St. Lucie County. We do an excellent job. There isn't another county around us that does it like we do it. And everybody from the bus drivers and the bus aides to the classroom aides to, I had a school where the principal insisted that every staff member come to the training, even the maintenance staff.
Right.
So everybody came so that they learned, what about this child, and if the child was walking and the maintenance person happened to see something happen, they would know what
They
it
were
was.
ready, right.
They were ready for it.
Right.
So it's a very big collaborative effort, and just the Diastat alone would keep you very, very busy.
Yeah.
I think it must be a real comfort for families and teachers alike that that you all are available and that these kind of supports are in place.
And it's surprising because parents coming from other districts or other out of state even, when we explain to them how we do what we do in this county, you can see the relief on their faces because they've come from other places where, the medication wasn't available or the school wasn't going to, do the in-depth plan that we do, or, it wasn't available on the bus ride, or they had to walk to school or whatever. And so when we explain how we do it, there is a sense of, oh, okay, my child is going to be safe.
Right.
At school.
Sense of relief.
It's a big sense of relief.
And it really isn't just entailed just to the school year. There's also a summer health
Yes.
program. Could you tell us a little bit
Yeah.
more about that?
There's the, when we have extended school year, any child that goes for that, because they need it for educational reasons, we have to provide whatever health needs they have. We have to provide for that. So we, just like we do during the regular school year. So for ESY, it's called Extended School Year, we have nurses. So the nurses that work for us during the school year rotate through doing the summer program. And we will have medically fragile units set up at each summer school site, and we will have the nursing coverage that we need for those children to attend school for the summer.
Yeah, that's great. Now, you've mentioned medically fragile often, just in that terminology. Could
Yeah.
you explain to us more in depth what that really means?
Medically fragile children are those children who have significant medical issues that have to be addressed on a continuous basis all day long, whether they're in school or not.
Right.
So they would be those children who would need medical monitoring, like cardiac or respiratory, or we have children with that have feeding tubes that have to be fed that way. We have children with various seizure disorders that have things like a vagus nerve stimulator. It's an implanted device under their skin, and if they have a seizure in between the implant doing its job, then there's a procedure that we have to go through to ensure that we can access it, we can turn it on and turn it off again, and then stop the seizure activity. So there's very in-depth medical things that have to be done during a school day, and that would qualify that student as a medically fragile
right.
student.
Okay.
And so, like I said, sometimes they don't all end up in the medically fragile classroom because cognitively they may be higher level, then they don't need to be in that room, but they still need that level of service. And in some instances, we have had the one-on-one LPN that goes with that child into a gen ed classroom and stays with them during the school day to provide that service.
So there's some distinct criteria for what qualifies a student then as a medically fragile student?
Yes, and it's not only medical, but it's cognitive as well.
Okay.
So those classrooms, the children have, large cognitive challenges
Right.
as well.
Okay. And I want to follow up. How do we know when a student might need hospital homebound services?
We are not a medical facility. We're an educational facility. We can support a child as long as they're stable to come to school with whatever medical needs that they have. When the child is to the point where they're not medically stable and they can't really access the educational environment of a school, but they still may be able to benefit from a teacher coming out and working with them one-on-one, then we refer them to our hospitalized homebound program. And it's a process. The physician has about 4 pages of paperwork that have to be filled out, and it comes back to the district office to the homebound coordinator, who then reviews it and sends it out to the school, and then a meeting has to be held, and they develop an IEP. And so they have an individual plan for that child, and we can do it one of 2 ways. We can do it full-time homebound, which means the child doesn't come to school at all and needs the services at home for an extended period of time. It's not meant to be a permanent program.
Okay.
It's a temporary program until the child is well enough to come back to school. So we have some children who may be being treated for cancer and are too weak to come to school. Or we have several of our medically fragile students in the past. We have one right now that is on hospitalized homebound because the seizures are out of control. And so once they get the seizures back into control again, then the child will come back to school. And then we have some students with some rare genetic disorders that we seem to have a lot of in this county. And they can come to school on a temporary basis part-time. And so if they're strong enough and having a good day and they can come to school for the morning, then they'll come to school for the morning. And so we write their IEP plan to reflect the fact that they can be intermittent. So when they're feeling well enough, they can come to school and participate in school. But if they're not feeling well enough and they can't really come to on-site to the campus, then we write the plan especially for them, and we figure out, okay, if they're going to miss 2 to 3 to however many days the team decides, then we're going to send a teacher out to catch them up, to help facilitate that they don't get behind in their classwork.
Okay, so it sounds like you're very individualized.
Very
Every
individualized.
student has an individualized
Every student
plan.
is different.
Okay.
And it can go from temporary, intermittent homebound
Mhm.
to permanent, back to intermittent, or it can just stay on, for the whole school year. That child may not be able to come to school, and they can stay on homebound for the entire school year. But it
Okay.
gets reviewed every single year, and that program ends every June. So, and if they're going to have to come back on the program again for the following school year, then we have to have the physician's orders all over
All over
again.
again, yeah.
And everything filled out again. The team has to review it and see whether it's appropriate. And it's an IEP team decision as to whether or not that's appropriate for the child, because we always want to do the least restrictive environment. And so that team then decides with the physician's input, and usually a nurse is part of that team. And we discuss everything and decide, which program would be the best one
And I
for the
think
child.
in addition to being individualized, there are a lot of options. I think that's the important message to get across, because you might have, one student might have a healthcare plan. They might also have a Section 504 accommodation plan. And we've already talked about what an IEP is. Can you talk a little bit more about what a Section 504 plan is?
You can actually have a healthcare plan under a 504.
Okay.
So the 504 plan is to ensure that a student with a disability doesn't get discriminated against. And so we have accommodations that we're going to do for that student because they have that disability. Now, their disability may require that they have a health care plan, but not necessarily.
Okay.
Any student, the health department nurses write health care plans all the time on gen ed students for asthma, for EpiPens, for all different kinds of things. And I also write a lot of health care plans, obviously, and so do the nurses that I supervise. And those children have IEPs. So then when it's an IEP, then they have an IHP, which is an individual
Okay.
health care plan, and that works in conjunction with their IEP.
Right. I think it's important to talk about, because parents hear all of these different acronyms,
Yeah.
all these different letters, IEP, IHP.
Yeah.
So
Care plan.
Yeah.
I
So
just wanted
it
to
gets
clarify that.
it gets a little bit confusing. But if you have a child that has a significant medical issue, then you need to ask in the clinic, you need to ask the health aides that work in our clinics to speak to the health department RN. And then the health department RN can then navigate the system for them.
Okay.
And that would be Josh.
Well, and Beth
And
Elizabeth
Beth,
as well.
yeah.
And there's the health
There's eight-
department. There's
yeah,
eight
there's
health
8 of us.
departments
Okay.
RN. So
Yeah.
every school has a health department RN that visits that school and checks the healthcare plans and checks the doctor's orders and works in collaboration with the health aide in the clinic. And so every school has one.
So you mentioned 8 nurses.
Yes, we have 8 RNs that are employed by the health department.
Okay, 8 RNs, and they serve how many schools?
39
39
schools.
schools,
Okay.
yes.
Okay.
And the Children's Services Council nurses have a lower nurse-to-student ratio.
Okay, I see.
Yes, and so as I said, I have 7 schools, and there's other nurses that do the basic school services that have about 5 to 6 schools as well.
Okay.
And are you able to get to the schools on a weekly basis, or
We-
does it just kind of depend on
We try
needs?
to get to the schools on a weekly basis. Sometimes that doesn't happen. Sometimes we spend, we may go to a school, 3 different schools during a day.
Right.
It just depends what's going on.
follow up and
Yes,
just-
or if there's a
right.
meeting we need to be to, or if there's child-specific trainings that we need to go. Because after we write our care plans, as she was talking about, we go back and we meet with the teachers to go over the care plans with them, just so that they, understand what's going on, because we're not there every day.
Yeah. And that's so important that parents understand too, that it's not just the nurses or the healthcare professionals, it's the teachers as well that are trained and kept up,
And especially if they're going on field trips.
Right.
Yes.
Right. I remember always making sure that emergency kit was always with us.
That's great.
That was
Yeah.
like the first thing we always did was double check to make sure we had, what we needed for the field trips to make sure that every kid gets the opportunity to do it.
Yeah.
Which is wonderful.
We talked about the EpiPens and Diastat and some other things. But as far as medications for students, Tricia, I guess you could start with this, but who dispenses the medications at the school level, and what are some of the qualifications of the people that do that?
Health paraprofessionals are in the clinics. Nurses delegate to them that they can dispense medications, whether they're daily meds, PRN meds, which are as needed, could be an inhaler, or emergency meds. Their qualifications is they have a certificate. They take a class, but they don't have a license. So I don't know. The clinics do not have nurses. Sometimes they refer to the health aides as nurses, but they're not nurses in the clinic. They're unlicensed assistive personnel or health paraprofessional.
Under the direction of an RN?
Yes.
Okay.
Yes.
And they receive training all year long on various.
Yeah.
Yes.
Yeah.
And I think it's
First things.
important also to mention that when the health aide is out, if the health aide is sick, sometimes there is the principal appoints another person to cover the clinic, and that may be a secretary, and we also train them to cover the clinic and to administer medications. So we work closely with a lot of the staff.
Yeah.
in
So
the
there's
school.
always somebody there
Yes.
and available.
That's trained, yes.
One of the things that always comes up, I know, as a concern, and I'm a parent as well, so this is something that maybe you can inform me on just as much, but immunizations, there are required immunizations that for students to even be in school, correct? Can you tell us, and anybody could really chime in on this, what those immunizations are, and maybe allay some fears or concerns that parents or community may have about that?
Well, we have a policy of no shots, no school. So we make sure that all the children are vaccinated, especially kindergartners cannot start school without vaccinations. We make sure that they're up to date with their DTaP, which is tetanus, pertussis, diphtheria, MMR, measles, mumps, rubella, varicella, which is chickenpox,
Okay.
hepatitis B, and polio. We make sure that they have all their vaccinations. And 7th graders, before they can start 7th grade, have a Tdap as well. So it's this, we call it as 6th grade, I'm sorry, not 7th grade, 6th grade, a 6th grade Tdap. So before they can start 6th grade, they have to have a Tdap. And we recently, with the district, the health department, the district worked with Healthy Schools last week to vaccinate students and staff with the flu mist or the flu shot. We vaccinated over 2,200 students and staff.
Wow.
Yes.
Okay. That's what I was going to ask me about as well, because I know you probably worked in collaboration with Ms. Pennington
Yes.
Yes.
for the
Yeah.
flu. I know
Yes.
she was out doing this flu vaccinations last week.
Yes,
You say it was?
last
week
Thursday and
one-
Friday.
One day this week? I think they did one
the
day this week
district.
too.
Yeah,
Tuesday.
the district office.
Yeah.
Yeah.
Okay.
So,
Yeah, Kim Pennington set up the schedule and staying in contact with the Healthy Schools and giving everybody a schedule. So it was very organized.
Yeah. Which is no surprise because she's a
Yeah,
very
she's very
organized lady.
organized. Very,
She's a
very
very organized lady.
and she, we sent out letters. I was in the office one day and I was listening to her talk to health aides about, okay, here's your, the letters came in, they had to be batched up and sent out to the schools, and then the health aide would call and say, I need some more letters in Spanish, or I need some more, I need this many more in English. And so she made sure that all the schools had the letters that went out to parents ahead of time that explained what it was, and the permission slip to fill out and be signed by the parents, so when the team came to their school that the child would be able to get the flu mist.
Yeah. And just before we started the show, we were talking a little bit about some of the misconceptions of that flu shot. Can you maybe hit on that just a little bit? Because I know a lot
know
of
they
people,
had-
and you hear it a lot,
Yeah.
a lot of, I don't want to get the flu if I get the flu shot.
Yeah.
So can you kind of hit on that a little bit?
Generally speaking, there's very little side effects from getting the shot or the flu mist. I mean, you might jump in here, ladies, you might have a little mild temperature, or you might have some site pain if you had the injection, but
Well, the CDC recommended that they did the flu mist over the shot this year for if you could get it. If less, the age was from 2 to 49.
Right.
We're able to get the flu mist.
And for some of us that are over that 49, we had to go through the shot
Shot.
part.
Yeah.
Which is good too. So.
And those were just offered also, and you mentioned this, at the district office, the county office for staff.
Staff. And staff at school sites participated also.
Yeah,
Yes.
Yeah.
I remember hearing several people mention that they were going in and
And
getting their
it's, you know,
shots.
it's
yeah.
very, it's nice because it's convenient, you know, and when you work in a school system, when you work in a place where there's lots of kids, you know, stuff gets passed around a lot.
And
And
that's-
so to
Right,
get,
right.
to be able to do that on, you know, during the school day and have, you know, the kids get vaccinated and the staff also, so
Right.
it was a really good thing
And
to
really,
do.
our district does such a phenomenal job with employee support, you know, as a wellness program, you know, with Carly, working closely, I'm sure, with you guys, but just as a district, you know, kind of overseeing not just the students, but the employees. And I that's just such a great benefit because a lot of districts aren't able to do that. And St. Lucie County's definitely taken a strong role in that, which is great. So-
And I think Carly Fabricant, if I'm saying her last name correctly, but she's our health awareness coordinator in the district. You can correct me about her title. She was going to join us today, but she was not able to. But I think that I really like everyone to chime in. One of the things was the different awareness type of activities that she puts on as well. We've talked about diabetes awareness. She does so many different things in the district to support staff. And as someone who works in the school district as well as have my own children, I think it's very nice to have a big support.
She's a very good resource.
Very good resource. Yep. We need to keep our staff healthy as well as our children in the schools.
Yeah, love those Wellness Wednesday newsletters. I
Yeah.
always go through them, and you know, just
Lots of
great.
good tips.
It really is.
Lots
It
of good
really
tips
is.
in
Great
there.
information. So,
It's important to keep children as well as staff healthy, fit, and ready to learn.
Yeah.
how well said. Very well said.
I also wanted to ask about any type of, you know, within this discussion about collaboration between the Department of Health and the St. Lucie County Schools. And through SHAC, are there assessments that are done on an annual basis every couple of years that, as community members and, you know, school district and county health department, that we work on collaboratively?
We work, the SHAC works on a coordinated school health. We do it every 2 years, and that's how we receive the Healthy Silver Award.
Okay.
So we do a survey and we evaluate, it's coordinated school health, which looks at 8 different areas, and it's counseling, healthy schools, staff wellness, and we also look at physical education, health education. So it breaks it down into different areas, and we can see where the school is, you know, within those areas. And we do a grading scale, and then we submit it to Tallahassee, and they grade us or award us. So this is the second year we've received the Silver Award.
Well, that's great.
Yes.
That's wonderful.
Yeah.
And you brought up a great point as well about something we don't think about when we're talking in terms of health services is mental health. Is there anything you can touch on when it comes to that? Because I know, like you said, the assessment also covers coordinated mental health services. And we have a mental health collaborative in the district that will probably have a whole
Another
different show on.
Yeah,
But,
different show.
but I think it's important for our audience to know that we're looking not only at you know, what we think of as medical, but also mental health.
Well, you know, we look at the whole child, you know, so it does cover mental and counseling. I think it's very important to find resources for mental health.
Definitely. Thank you. Okay. Yep. Is there anything else that you'd like to share with us or the viewers about health services? Any upcoming events or just anything else you'd like to share before we close?
On
Saturday,
there's the Disability Expo is at the Kite Center.
Great.
Indian River State College.
Indian River State College, and there'll be some really good speakers and lots of good information there for parents of students with disabilities. And I really encourage everybody to attend. It's not only just for parents, but staff and anybody interested in learning about the different issues. This would be a very very good venue for them to go to.
And that's Saturday?
It's Saturday, yes. I think it starts at 8, and I'm not quite sure how long it goes, but
Okay.
it starts about 8 o'clock in the morning
And
at
some
the
of-
Kite Center.
And some of the collaborators that will be there?
There's lots of people, lots of speakers that are going to be there from different agencies and some from the school district, and they'll talk about all different kinds of things. Transition for our older students, transitioning from school to, the next step in their lives, and just all kinds of really good stuff
Okay,
for
sounds
parents
good.
and teachers.
And that's on
good.
the main campus of IRSC.
IRSC,
All right,
yeah,
just
in
for our
Fort
viewers
Pierce.
who
Up
may
in
not
Fort
be
Pierce.
aware of
Yes.
the Kite Center, but
Yes.
it's a great facility, and
Yeah.
they're always great about opening up their doors for
Mhm.
St. Lucie County, so that's
Yeah.
great. Good.
Ladies, we'd like to thank you very much for being on the show today and for all the great information that you shared. It would be a real benefit to not only our community viewers, but also our staff and faculty that serve our school system. So thank you all for being here very much.
Thank you.
Thank
Thank
you.
you.
And for more information, we've got some contact numbers I know we want to
Mhm.
throw out to the community members. And on the screen, you'll be able to see, I think, the student services number at the district office with the Students Department of St. Lucie County Schools. Greg, you want to read that one for us? Can you read that number for us?
429-4510. That's the Student Services phone number.
Right. As
Thank you
well
very much.
as, I believe we've got the health department number as well. And I'm kind of cut off the screen. I can see the last 4 digits, but not for the
Okay.
first 3. So we'll let you read that
For
one.
the Florida Department of Health, St. Lucie County is 370-8370.
And thanks so much for joining us for this month's edition of Notebook. We're glad you're with us, and we hope you take this information and use it to better our community and just share with people around you some of the things that you've learned today. Thanks for being with us, and have a great month.
Thank you.